ethical standards and before to start the record, is anyone okay to be recorded for this webinar? Because we want to have notes for report purposes. Yes. It's a part of a Lunch and Learn webinar series of the CUPID project, Cancer Screening and Prevention for People with Intellectual Disabilities. This is the last webinar we had for, I think, since February or March this year. My name is Vera Dimitrievska. I'm senior researcher as part of the team at the University of American College in Skopje, Macedonia. And I will try to give you some examples and stories and some theoretical aspects of the ethical research in practice for people with intellectual disabilities today. So welcome again. The outline of this webinar is very simple. We're going to focus on why ethics matter in research with people with intellectual disabilities. What are the key ethical, very well-known principles for ethical research, which are for all research designs mainly compatible, and how ethics strengthen research quality. What are the practical tips and resources? As I said, I will give you several examples and stories from experience that we had with research with people with intellectual disabilities, and Q&A, questions and answers. The webinar objectives are very clear. By the end of this webinar, the participants who are part of this webinar will try to understand what are the key ethical principles in disability inclusive research for people with intellectual disability, to recognize the barriers people are facing with intellectual disabilities in cancer research and care, to explore what are the practical approaches for accessible and inclusive research, and to learn how ethical practices improve research quality and participant protections. And the main thing is to reflect on good practices and recommendations for future research. So why ethical research matters? Because the people with intellectual disabilities are facing with significant health inequalities and vulnerabilities. In order to be part of certain research, design, and study, they don't have to face with barriers in cancer prevention, screening, and diagnosis, and treatment are often underrepresented in the research. Therefore, we think that it should be the research studies for cancer preventions should be meaningfully for the people with intellectual disabilities, and to use certain advanced communication and methods in order to assent or to participate in certain study. And we strive to have equal participations to build stronger evidence for the research and to reduce their exclusion and discrimination. And the best way is to build trust with them. So what is the disability inclusive research? It is involving people with disability in a meaningful way, and to have not just a compliance with the research, but also to have respect for them, to remove their barriers to participate. And the key principle for this research, if you involve people with intellectual disabilities, nothing about us without us. It means that people with disabilities have to involve from each stage for the research, even with the starting with the research design, when you design the tools like interviews, the polls, the focus groups, in order to be part of the certain study in a very democratic and participative way, where you can have their voice, their decision, their trust from them, and to get consent to be part of the research. So the core ethical principle in research are to respect for persons to respect their autonomy, to respect their informed decision making, and preference and dignity. The second one is the benefits, to maximize their benefits and to minimize their harm, and to avoid any physical, psychological, or social harm, to get justice in the research, to be fair included, and to have equal access, and to avoid any exclusion from research benefits when you do the research study, especially for people with intellectual disabilities. And the last part is the very important, the confidentiality and the privacy, where the people with the intellectual disability should be protected from any sensitive personal and health information to not reveal their personal data for later in the report when you do the public report or even during the research design. So these ethical principles are relevant not only for the people with intellectual disabilities when you do the research, but also for any control group or research group for the research design and the research study. So what is a research consent? It is the informed, involuntary, and explicit agreement of a competent person to participate in a research study after being fully informed about its purpose, procedure, risk, benefits, and their rights, including the right to withdraw at any time without penalty. So it's a simple piece of paper where usually we use it to sign it. When you do the start the research before to start the research either interview or as I said poll or questionnaire. So it's a fundamental ethical principle that ensuring participants to understand what their involvement entails and they're not forced into participating. It should be on their will, and if they want to participate, yes, or if they don't want, we respect their decision. The rules around the consent to participate in research for people with intellectual disabilities can vary significantly through countries. They reflect differences in legal frameworks, ethical traditions, disability rights movements, and interpretations of international conventions, such as the UN Convention of the Rights of Persons with Disabilities. So, maybe in certain countries, they don't allow people with disabilities to have, let's say, certain be part of certain study. So as I said, that can be uh, vary from different countries. The second very important thing is the capacity vis-a-vis competence. So many countries assess whether a person can provide informed consent based on decision-making capacity to understand their appreciation, reasoning, and communication. If it is that part incapable, alternative pathways are taken. So proxy consent, assent, supported decision making, it comes into play in this comes into the play in this case. So if the person with intellectual disability is not able to make own decisions, so let's say the guardians or the proxy consent is available. So what is the role of the guardians or proxies? Some countries allow legal guardians to consent on behalf of an individual. Others require both participants' assent and guardians' consent. A growing trend is towards supported decision making rather than substitute decision making. So recently I had a study where we were researching the people with disabilities, whether they have access to water. So most of the people were with severe disabilities, but had, let's say, physical disabilities, but had kind of small or mild disabilities where the decision was made by all of them, by their proxies or the guardians or the family support. Uh, right now, I will share three examples, which I'm really thankful from the Professor Dr. Suzanne Denis from the Waterworld University that are shared on our ECR event. It is Early Career Research event in Amsterdam last year, where we talk also about ethical research among young researchers from their experience that they're faced with intellectual disabilities research studies. So I will have Maria studies, Aisha studies, and Sophie studies, how the consent was acquired and how was resolved at the end by the researchers. I will read the story, and in the chat you can give your thoughts how to proceed with some ethical dilemmas in the ethical research for this target group. And afterwards, we can go through and I will give you the possible answers. So Maria's story is a 40-year-old woman with a mild intellectual disability who lives semi-independently with support from a visiting caregiver. She was invited to take part in the research study on cancer screening. What was the consent encounter? When presented with a standard consent form, Maria struggled. She became very anxious at words like confidentiality, data storage, and withdrawal of consent. She initially said, I don't know, I don't want to sign something I don't understand. What would you do as a researcher in this field? So you can drop your thoughts in the chat box and we can see your, let's say, perceptions or attitudes and views about this. Aisha's story, which is the 36-year-old woman with a moderate intellectual disability who lives in a supported group home. When the research team introduced the study, Aisha became distracted and repeatedly changed topics. Even with an easy read sheet and pictorial aids, she couldn't demonstrate an understanding of what participation would involve or that she had a choice to decline. When asked if she wanted to be part of the study, Aisha nodded, but then immediately asked about going shopping, suggesting she didn't fully grasp the context. If you have thoughts about Aisha's story, just put it in the chat. How you would try to get consent or regulate the thing. Sophie's story, which is 20-year-old woman with a mild ID who works part-time and lives independently with minimal support. At first, Sophie was nervous. I don't like signing things. What if I do it wrong? So for Sophie's story, if you have something in mind how to proceed, just also to drop in the chat and say Sophie slash my answer. I will give you, let's say, 30 seconds to think about this. Everyone okay? Or if I can go back to see again, or we can go together with the possible answers. So for the Maria story, possible researcher responses is to support her decision making. The researchers use an easy read consent sheet with short sentences, symbols, and pictures, for example, a log of which represent the privacy. Then they explain each step in plain language, like we want to ask you some questions about going to the doctor for checkups. You can say yes or no. If you say yes, no, you can change your mind later. So everyone you want to reassure with the participants about the consent. Her caregiver to stay with her, but she was asked not to answer on her behalf, only to help explain if Maria requested. Anything else should be considered about this? Maria signed the easy read form herself with her caregiver, co-signing to acknowledge support. Throughout the study, researchers checked back with Maria to make sure she was still comfortable. On one occasion, she said she was too tired to do an interview that day and the session was postponed. That's why I respected her process consent. So if she wants to decline or she wants to step back, then we also respect that. This story shows that Maria was with the right adjustment. A woman with ID can exercise agency in designing to participate. Traditional consent forms and processes often exclude people. So that's why I said it should be uh, completely, let's say, modified and adaptive consent. Respecting small but important choice like postponing an interview strengthens the ethical participation, but also gives an evidence for the research later. Aisha's story, best outcome was couldn't show comprehension or provide assent. The researchers ethically decided not to enroll her, even though her legal guardian had offered proxy consent. The main key learning was respecting the participants' autonomy sometimes means recognizing when consent and assent cannot be meaningfully obtained. Sorry. So in this case, she was quite unsure to participate. Sophie's story, to remind you again, is a 29-year-old woman with mild ID who works part-time and lives independently with minimal support. At first, Sophie was nervous. I don't like signing things. What if I do it wrong? The researchers explained that meant she agreed to talk about her experience and that she could stop at any time. So for this case, the researchers used a role play, acting out, saying stop or changing your mind. So Sophie felt confident she had control of the research, of the being part of the research. So the main key learning from Sophie's story was process consent and role play strategies can empower participants with ID to engage meaningfully, building trust and safeguarding autonomy. So for this case, you can see we used the researchers used different approach, the role play strategy in order to be part of the research study. So the main question that should be considered when you do the research for with such sensitive group or target group, let's say people with intellectual disabilities, should be proxy consent allowed in research, focus on personal experience such as cancer screening, uh, and research face an ethical dilemma often, how to respect autonomy while ensuring protection. So these main things by as researchers you can always try to think about and how to use it and how to approach it in order to get let's say certain data for these people. And always when you have a research study to with these people with disabilities, intellectual disabilities should be considered accessible information. You should have development of easy read consent forms that are simplified with text symbols and pictorial aids in order people from the other side to be understand it, because it should be written in very simple way. Otherwise, it's not understandable. As you know, we have people with ID and supported decision making. Participants encouraged to have a trusted support person, family member, caregiver, or advocate present during the consent process. Um, and the process consent, instead of one-time signature, researchers revisit the consent as we had with the Aisha's or with the Sophie's story with multiple points during the study to ensure ongoing understanding and willingness. Consent plus proxy consent, where women are enabled to give fully informed consent. Assent can be sought from the participants alongside proxy consent from a legally authorized representative. This is very country specific. Even in my country, in Macedonia, we are not much. I don't know, Professor Vladimir maybe has experience, but so far I didn't use this part. And also, you must know the legal situation in your country when undertaking research, especially with the ethical boards at certain universities. They have different protocols and rules for ethical approval. So these were the examples. Special thanks to Professor Suzanne on these stories and their experience during the research for people with intellectual disabilities. And in general, we covered everything for this webinar regarding the ethical part in research with people with intellectual disabilities in this period. So thank you again. And if you have dropped something in the chat, we can go through it and talk about that. Any questions? Any thoughts about these stories? Or if you have faced differently from this part, you can also share it.
Hi, Vera.
Hi.
I'm actually in my car. Sorry, in
Okay, I
transit.
can't see you. I don't know. Hi, Margaret. How are you?
I'm good. Listen, I was just wondering, because maybe parts of it, the road wasn't good, so I may have missed on something. But you said ideas about ethics. So if they're used to doing examples prior to the research, would that
Yes.
help, or have you discussed that?
You mean the people with ID to be part of the research design?
Yeah, where they have kind of little sessions where they actually become involved in signing, but it's a
Yes, we covered it.
priori
Yes,
the
yes,
research.
yes, yes,
Yeah,
yes, yes. Yes, we did. It is very valuable, but because I am quite a senior researcher lately, 15 years, we don't do also with people ID. We also do with a lot of different groups like women
yeah.
and children and the other proxy methods and being part of the research design, respecting their
Okay.
democratic part and being part of the study. Yes, yes.
Thank
I
you,
didn't see that
Vera.
you have. Thank you, thank you. Anyone else, if you had something different approach, you can share with us if you like, or from the other country perspective.
Hi, Vera. Thank you so much for delivering that session and doing it so
Yeah,
well.
thank you, Suzanne. I granted your valuable experience and stories from the Amsterdam meeting, and they were really. I was trying to find from my experience, but I don't have a lot. It's a different approach, and then I decided to use yours. It's really nice
No problem at all.
example.
I'm delighted to see them being used. The one thing that is useful is to consider the role of family members, because in
Yes.
my experience, sometimes family members being very protective of their family member,
Yep. Yep.
they sometimes are very reluctant to let that family member take part in research. And I'm wondering, has anyone an idea as to how that might be addressed and how we could support family members to be take
That's
part
also
in
important.
research?
Yes, that's very, from my personal experience, I have relatives with these issues, and I could say that it's really difficult to convince parents and family members to be part of their children, let's say people with ID to be part of their study. They're very reluctant often, especially it is context-based in this case here. So even the parents that don't consider them as available to be part of their study in order to have future better results for their well-being. So that's my experience in general. If you have different, yeah, but so far not very positive examples.
I think Patrick wants to come in.
Yeah,
Yes, I had a question. If you, we had the experience that if you explain very good to people who want to participate at research, certainly in interviews, that we have the problem that they are so well informed that we don't have the information how they react on the information we give normally to the people of the screening program, and and you ask, what do you find of this? Do you understand? But as the preparation was so intense and so detailed, then you have a bias because you give them more information than other people have at the beginning. So you don't have the answers how people who are not prepared would react on the information we give. How do you solve that? That the preparation sometimes is so good that you change the results of your interview. I'm not clear.
No, it's very clear, Patrick. It's a very interesting situation because you want to ensure that they are fully, they have all the information so they can give informed consent, but yet you don't want to introduce the bias. I I I haven't come across that situation previously myself, but I can imagine how it would happen. So I wonder, in giving the information, does it have to be specific to the topic, as in to try avoid that bias? Do you give more generic information? Would that help?
yeah,
I
that
mean,
could be
to
also.
give a broad overview of the study, but not the specific questions that might be asked.
Yes.
Or maybe it's sample questions from a different type of area so that they've met that question type before, but not maybe the specific topic.
Yeah, but the problem would be that if you ask something about screening and you have to explain that what screening is at the beginning. So
Yeah.
we had an interview preparation some weeks ago, and then afterwards it was a very good conversation. But afterwards, they say we can't use this expert to have an interview, only to know how we have to involve others, but because she doesn't represent anymore the public we want to ask their opinion. That's so I think it's a difficult uh, weighing of how many and what information give before and what you have to know what she thinks. Even it's not
Mm.
the a good perception of what screening is, because that's you expect a little bit that sometimes they don't understand what screening is. But if you explain it before, then,
Yeah.
so
Margaret mentioned involving people with intellectual disability in designing a study. So maybe if there was an advisory group who, with people with intellectual disability, who could talk to you about, well, what is it we would need to know before we take part in this study, so that they are prepared for the study, for the data collection, but that you can avoid that bias. And maybe by involving people with intellectual disability to design the information sheet or the information method, maybe we could avoid that issue of introducing bias. Might that work?
yes,
Yeah, as I
Worth
mentioned, yeah.
considering.
That's also makes point. Makes sense. But at the end, you collected the data, or
like it was more or less the preparation to start the study. So we will
yeah.
go the way that she will advise how to start the study and not being part of the expert panel
Mhm.
to give the answers to the interviews. So we start a little bit to solve that in that way. But yeah,
Yeah, Susanna was right. Using being part of the research design, as I said at the beginning, is also an option because it's a very, very sensitive part, and yeah, I know that it's not easy to get the answer. Thanks, but thanks for brought this. It's really thoughtful and having it to be considered for the next research studies. Anything else? I think if we are okay. If nobody has question or comment, yeah, then we can finish and say thank you. Thanks, Suzanne. Thanks for yeah, uh, helping with this, and it was really nice have this part of webinar.
Sorry, Vera, sorry to interrupt. There is one more comment there in the chat
Yes,
from Sene.
maybe we need multidisciplinary team for collecting data from IDD persons. Yes, as I said, as part of the proxies and guardians, also it depends of what kind of study is and what we require from the research process and from the data. So also it can be an option, but not a very broad team in order to not yes make another bias. Um Yes, Vladimir is reminds us about our final conference that is taking place in Brussels next month. Here is the link for the conference on 22nd of June.
23rd and 24th, sorry.
23rd, 24th, sorry. Thanks. And the more information about the CUPID conference are available on the website. Thanks again. Thanks for your attention and time. And you can always drop us message if you need about the ethical dilemmas, me and Suzanne. for this project or for the research in future. So we are open for collaboration. Thanks again,
Thank you all.
and bye. Bye bye.
Bye bye.
Thank you.